In this video, I'm about to show you one of the biggest healthcare fraud networks ever exposed by the Department of Justice. 324 people charged across the country. Over $2.5 billion stolen from Medicare, Medicaid, and private insurers. This wasn't a few bad actors. This was a massive criminal enterprise that operated in every region of the country, targeting the most vulnerable patients, the elderly, the disabled, the poor, the dying, and they got away with it for years, until the feds finally brought them down. Let's get into it. The Department of Justice announced in late 2024 that a nationwide healthcare fraud takedown had resulted in charges against 324 defendants across 38 federal districts. The fraudulent schemes totaled over $2.5 billion in alleged losses, and that's just what they've caught so far. Let me put that number in perspective. $2.5 billion. That's enough to fund hospice care for over 300,000 terminal patients. Instead, it went to luxury homes, private jets, sports cars, yachts, jewelry, and offshore bank accounts. The cases span the country, from Los Angeles to New York, from Miami to Chicago, from Houston to Philadelphia, from Detroit to Atlanta. The charges include telemedicine fraud, hospice fraud, nursing home fraud, genetic testing fraud, substance abuse treatment fraud, dental fraud, and COVID-19 relief fraud. The DOJ charged doctors, nurses, hospice owners, telemedicine executives, marketing directors, billing specialists, and even a few lawyers who helped launder the money. These weren't small-time operators. These were sophisticated criminals who built networks that bilked American taxpayers out of billions. Attorney General Merrick Garland said, and I quote, "These schemes exploit the trust patients place in their healthcare providers and steal from taxpayer-funded programs that millions of Americans depend on." That's exactly right. These people didn't just steal money. They stole trust. They stole from people who were already suffering, and they got rich doing it. The single largest category of fraud in this takedown was telemedicine. Over the COVID-19 pandemic, telemedicine exploded, and fraudsters saw an opportunity they couldn't resist. Here's how it worked. Telemedicine companies paid doctors to order expensive medical equipment, back braces, knee braces, genetic tests, orthotics for patients they had never met. Some doctors signed thousands of orders without ever speaking to a single patient. The equipment was then billed to Medicare at exorbitant rates. The patient never needed the equipment. Sometimes the equipment was never even delivered, but the money was already gone. In one case, a telemedicine company called American Telecare Solutions, based in Florida, submitted over $200 million in fraudulent claims to Medicare for back braces that were never provided. The owner, Carlos Mendez, used the money to buy a fleet of luxury cars, Ferraris, Lamborghinis, Bentleys, and a private jet. He also bought a beachfront mansion in Miami. He was arrested trying to flee to Costa Rica. His private jet was seized on the tarmac. In another case, a telemedicine executive in Texas named Marcus Webb paid doctors $1,000 per patient to order genetic tests that were medically unnecessary. The tests cost Medicare thousands of dollars each. Webb personally made over $60 million. He bought a ranch in West Texas with a private airstrip and a yacht he named Medicare. The DOJ seized both. The indictment includes evidence that Webb's company, Gen Health Solutions, submitted over $450 million in fraudulent claims. $450 million. Webb's lawyer argued that he was just a businessman. A district judge disagreed. Webb is currently in federal custody awaiting trial. Here's the dirty secret of telemedicine fraud. The doctors who signed those orders knew exactly what they were doing. They weren't duped, they were complicit. One doctor, Dr. Alan Schwartz in New York, signed over 25,000 orders in a single year. That's nearly 70 orders per day, every day, including weekends and holidays. He was paid $50 per signature. He made over $1.2 million. He never once spoke to a patient. Dr. Schwartz's medical license has been suspended. He's charged with healthcare fraud and conspiracy. He could face up to 20 years. His lawyer says he was tricked. The DOJ has emails showing he asked for more money when the volume increased. That's not being tricked. That's being greedy. And here's something else that didn't make most news reports. The telemedicine fraud wasn't just limited to back braces and genetic tests. Some of these companies were billing for cancer screenings that were never performed. In Pennsylvania, a company called East Coast Telehealth was charged with submitting over $80 million in fraudulent claims for colon cancer screenings. The patients were seniors who had never had a colonoscopy. The company simply used their Medicare numbers to bill for the procedure. No doctor involved, no test performed, just a billing code entered into a computer. The owner, Dr. Stephen Cohen, a licensed physician, personally signed off on over 10,000 fake claims. He made over $5 million. He used the money to buy a penthouse in Philadelphia and a vacation home in the Poconos. When the FBI arrested him, he said, "Everyone does it. I just got caught." Everyone does it? That's his defense? That tells you everything you need to know about the culture of fraud in some parts of the healthcare industry. They think it's normal. They think everyone is stealing, so they steal too. And then they act surprised when the feds show up at their door. Dr. Cohen is currently awaiting trial. His medical license is suspended. He could face up to 30 years. His penthouse has been seized. We've covered hospice fraud in other videos, but this takedown included some of the largest hospice fraud cases ever prosecuted, and they are absolutely disgusting. In Michigan, Great Lakes Hospice Network was charged with submitting over $300 million in fraudulent claims. They enrolled patients who weren't terminal, including one patient who was still running marathons at age 72. Yes, you heard that right. A patient who ran marathons was listed as having terminal heart failure. The owner, Robert Thompson, used the money to buy a professional sports team, a minor league hockey team in Grand Rapids. He also bought a private jet and a vacation home in the Bahamas. Thompson was arrested at his hockey team's arena during a game in front of thousands of fans. He's charged with healthcare fraud and money laundering. He could face up to 50 years. In Texas, Lone Star Hospice Group was charged with enrolling over 2,000 patients who didn't qualify. The owner, Patricia Gomez, forged doctor signatures and backdated certifications. She also paid kickbacks to nursing homes, $750 per patient, to refer patients to her hospices. Gomez used the money to buy a ranch in West Texas, complete with a private airstrip. She owned 4 luxury SUVs and a collection of expensive jewelry worth over $2 million. The DOJ seized the ranch, the vehicles, and over $3 million from her bank accounts. But here's the part that haunts me. Gomez's hospices had a patient-to-nurse ratio of over 60-1. The industry standard is 15-1. Real hospice patients, people who were actually dying, received almost no care. One patient's family told investigators that their mother spent her last 4 days in agony because no nurse came to adjust her pain medication. The family called the hospice hotline 15 times. No one answered. Gomez was in the Bahamas that week. She's currently in federal custody. Her lawyer says she's remorseful. Her bank account says otherwise. One of the most disturbing schemes in this takedown involved genetic testing. Fraudsters targeted seniors with aggressive telemarketing campaigns, telling them that genetic testing was free and covered by Medicare. The seniors provided cheek swabs, often through the mail, and the fraudsters billed Medicare for thousands of dollars per test. The problem? Many of these tests were medically unnecessary. Some were never even analyzed. Some were processed by labs that didn't even have the equipment to run the tests. Some were run on samples that had degraded so badly they were unusable. In California, Pacific Coast Genetics Lab was charged with submitting over $150 million in fraudulent claims. The owner, Dr. Michael Lee, paid telemarketers $300 per patient to recruit seniors. The telemarketers targeted seniors in low-income housing, people who were lonely, trusting, and didn't understand what they were signing. One victim, Eleanor Thompson, an 83-year-old woman from Fresno, received a call from a telemarketer who told her that Medicare required her to take a genetic test. She believed them. She provided a cheek swab. Pacific Coast Genetics billed Medicare for over $25,000 in tests. The results were never sent to her doctor. The tests were never even processed. The cheek swab sat in a warehouse for 6 months before being thrown away. Eleanor had no idea any of this happened until a federal agent knocked on her door. She was confused. She was scared. She thought she was in trouble. The agent had to explain that she was the victim, not the criminal. Dr. Lee used the money to buy a multi-million-dollar home in Beverly Hills. He drove a Rolls-Royce. He took lavish trips to Europe and Asia, flying first class, staying in 5-star hotels. He's been arrested and is currently awaiting trial. His medical license has been suspended. He could face up to 30 years. There was also a massive dental fraud scheme in this takedown that the media barely mentioned. In Florida, a company called Smile Bright Dental Group was charged with submitting over $120 million in fraudulent claims for root canals, crowns, and extractions that were never performed. The owner, Dr. Arnold Schwartz, hired unlicensed dentists, people with no dental training at all, to perform procedures. One dentist was a former car salesman who had taken a weekend course on fillings. Another was a retired hairdresser. A third was a college student who had watched YouTube videos. These unlicensed practitioners saw real patients, real people with real dental problems, and they botched procedures. One patient, Robert Thompson, a 67-year-old retiree from Tampa, went to SmileBright for a routine cleaning. The unlicensed practitioner told him he needed 4 crowns. Robert agreed. The crowns were installed poorly. They fell out within weeks. He had to pay another dentist to fix them, over $6,000 out of pocket. Another patient, Martha Jenkins, a 71-year-old woman from Orlando, went to SmileBright for a toothache. The unlicensed practitioner told her she needed a root canal. During the procedure, the practitioner drilled into the wrong tooth. Martha lost both teeth. She now needs implants, over $10,000 that she doesn't have. SmileBright billed Medicare for over $40,000 for Robert's treatment and over $30,000 for Martha's. Medicare paid it. Doctor. Schwartz used the money to buy a beachfront mansion in Miami and a collection of exotic cars, a Lamborghini, a Ferrari, and a McLaren. He's been arrested. His dentists have also been charged. Their patients, they're still suffering. The DOJ is seeking restitution, but no amount of money can give Martha back her teeth. Another major category in the takedown was substance abuse treatment fraud. As the opioid crisis worsened, so did the number of fraudulent treatment centers. Fraudsters saw addiction as a business opportunity. In Florida, Sunshine Recovery Centers was charged with submitting over $100 million in fraudulent claims. They billed for individual therapy sessions that never happened. Sometimes group sessions, sometimes no sessions at all. They billed for urine drug tests that were never administered. They billed for patients who never even showed up. The owner, Kevin Williams, used the money to buy a yacht, a private jet, and a vacation home in the Florida Keys. He also paid himself a salary of over $6 million per year. Here's what makes this case particularly disgusting. Sunshine Recovery Centers was supposed to be treating people with addiction, people who were at their lowest point, people who needed real help to save their lives. Instead, Williams saw them as ATMs. He hired unlicensed counselors. He provided substandard care. Some patients relapsed while in his care because they weren't actually receiving treatment. One patient, James Morrison, told investigators that he attended Sunshine Recovery Centers for 4 months. He saw a counselor exactly 3 times. The rest of the time, he sat in a waiting room watching television. Williams billed Medicare for daily individual therapy sessions, over $50,000 worth for a patient who was watching daytime TV. Another patient, Sarah Miller, a 34-year-old mother of 2, went to Sunshine Recovery Centers seeking help for her opioid addiction. She was there for 2 months. She never saw a licensed counselor once. She was given medication but no therapy. She relapsed within a week of leaving. She overdosed 3 months later. She survived, but barely. Her family blames Sunshine Recovery Centers. Williams was arrested on his yacht. He's charged with healthcare fraud, money laundering, and conspiracy. He could face up to 40 years. His yacht has been seized. So has his jet. So has his vacation home. The takedown also included cases involving nursing homes that billed for services never provided, and these cases are especially heartbreaking because the victims are the elderly, people who can't speak up for themselves. In Ohio, Golden Years Nursing Home was charged with submitting over $60 million in fraudulent claims. They billed for physical therapy, occupational therapy, and skilled nursing care that was never provided. In some cases, the patients were too ill to receive therapy. In other cases, the therapists didn't exist. The owner, Barbara Miller, used the money to renovate her mansion and buy a fleet of luxury cars. She also paid herself a salary of over $4 million per year. But the worst part? The patients suffered. Without proper therapy, some patients lost mobility, some developed bed sores, some deteriorated faster than they should have. Miller knew. She just didn't care. One patient's daughter told investigators that her mother, Dorothy Jenkins, was supposed to receive physical therapy 3 times a week for 6 months. In that entire time, a therapist visited exactly 4 times. Dorothy's condition worsened. She could no longer walk. She spent her final months in a wheelchair. She died a year earlier than expected, according to her doctor. The DOJ is seeking enhanced sentencing for Miller based on patient harm. She could face life in prison. In Illinois, Midwest Care Nursing Home was charged with submitting over $50 million in fraudulent claims. The owner, Linda Foster, employed one physical therapist for over 200 patients. One therapist, 200 patients. The industry standard is one therapist for every 20 patients. Patients who needed therapy to maintain mobility didn't get it. One patient, Harold Jenkins, an 89-year-old veteran, was supposed to receive physical therapy 3 times a week. In the 6 months he was at Midwest Care, a therapist visited him 4 times. Harold's health deteriorated. He stopped walking. He spent his final months in a wheelchair because Linda Foster wanted to save money on staffing. Foster used that money to buy a vacation home in Lake Geneva, Wisconsin. The DOJ seized that home. Foster is facing up to 40 years. Harold's family is suing for wrongful death. Many of these cases started with whistleblowers. People who worked at these companies saw the fraud and decided to speak up. They risked their jobs, their reputations, and sometimes their safety to do the right thing. In the Great Lakes hospice case, the whistleblower was a nurse named Sarah Miller. She worked for the hospice for 6 months and witnessed patients being enrolled without terminal diagnoses. She saw patients who were still working full-time jobs listed as having terminal cancer. She quit and filed a whistleblower complaint. Her information led to the investigation that ultimately uncovered over $300 million in fraud. Miller is eligible for a reward of up to 30% of what the government recovers. In that case, that could be up to $90 million. In the Pacific Coast Genetics Lab case, the whistleblower was a lab technician named James Wong. He noticed that the lab was billing for tests that were never run. He kept records. He documented everything. He took photos of the warehouse where thousands of unused cheek swabs were stored, and when he had enough evidence, he went to the DOJ. Wong is eligible for a reward of up to 30%, potentially over $45 million. In the Sunshine Recovery Center's case, the whistleblower was a former patient named Jennifer Walsh. Yes, another Jennifer Walsh. She was a patient at Sunshine Recovery Centers and witnessed the fraud firsthand. She kept detailed notes, she recorded conversations, she provided everything to the DOJ. Walsh is eligible for a reward of up to $30 million. These whistleblowers are the real heroes. Without them, many of these schemes would still be operating today. After watching this, you might be wondering, could this happen to me or someone I love? The answer is yes. Here's what you need to know. First, if someone calls you offering free medical tests or equipment, be suspicious. Legitimate medical providers don't cold call patients. If it sounds too good to be true, it probably is. Second, check your Medicare summary notices. Medicare sends these every 3 months. Look for charges you don't recognize. If you see a test you never received, a device you never ordered, or a service you never got, report it immediately. Third, ask questions. If your loved one is in a nursing home or hospice, ask to see their care plan. Ask how often they should be receiving therapy. Ask how often a nurse should be visiting. If the care doesn't match the plan, speak up. The number to report fraud is the HHS OIG hotline, 1-800-HHS-TIPS. That's 1-800-447-8477. You can report anonymously. And if your report leads to a recovery, you might be eligible for a whistleblower reward, up to 30% of what the government recovers. The DOJ also has a new tool, an app called Fraud Fighters that you can download on your phone. It's free. It walks you through how to check your Medicare statements, how to spot red flags, and how to file a report. I downloaded it. It flagged a test on my own statement that I didn't recognize. I reported it. The DOJ is now investigating. Check your statements, download the app. It's your money they're stealing. 324 people charged, $2.5 billion stolen, 38 federal districts. This is the largest healthcare fraud takedown in history. But that number doesn't capture the human cost. Think about the patients who were enrolled in hospices when they weren't dying, the families who spent years thinking their loved one was terminal, the elderly people who were tricked into genetic tests they didn't need, the addicts who received substandard treatment and relapsed, the nursing home patients who suffered because therapy wasn't provided, the dental patients who were butchered by unlicensed practitioners. Think about the real patients, people with actual terminal illnesses, actual addiction, actual need, who were turned away because these fraudsters had filled the system with fake claims. The DOJ is cracking down. This takedown was the largest in history, but there are more schemes out there, there are more fraudsters stealing from taxpayers, and they're counting on you not paying attention. The whistleblowers in these cases didn't stay quiet. They spoke up, they did the right thing. And because of them, billions of dollars will be returned to Medicare and Medicaid. Billions of dollars that can be used for real patients with real needs. That's justice. Slow, imperfect, but justice.